My name is Helen Walker from Great Community Transport. Helen, yes. My question is to the Minister. We're funded under the Home and Community Care program to transport the frail, elderly and people with disabilities in the Blue Mountains and Penrith area, and we've worked very closely with the area health in our two LGAs for many, many years. The non-government, the NGO program is under major review, which is the non-government organisation review, of which our funding has now been included, and it is a very small part for those people that aren't the frail, elderly and people with disabilities. And I'm wondering about the recognition of transport as an enabler and the huge number of requests that we get as an industry for medical and hospital transports. This is taking people from home to their treatment. 60% of our services requests are generated for health related. And I guess my wish is that Minister Berejiklian and yourself would be able to meet to look at this major issue. I'm sure you're aware of it. I'm on the Community Transport Organisation for New South Wales and we've raised it at that level as well, but I'm greatly concerned in the NGO review that we may lose our funding, and I know Kay and Patrick won't let that happen from their end because they know how valuable our service is. And Stuart Ayres is a great supporter because we've had to fundraise for a lot of our cancer care vehicles, which are driven by volunteers. So we're giving value for dollar, the few dollars we get, and I'm here to say, please don't ignore us. We want to work closely with health. We want to get people to and from their services. So that's my plea.
Thank you. Thank you. You provide value for dollar. You're providing a very important patient service. You can be monitored, you can be evaluated, you can demonstrate how you provide outcomes for the patients. That's exactly the kind of thing that we're looking at in evaluating the NGO funding program from health. So you tick all the boxes. In terms of patient transport, it is complex because of the different providers, and there's non-urgent patient transport that's provided through the ambulance service. We have reviewed the reviews. There's been many of them done into the ambulance service. We'll be landing very soon a plan to put in place some rearrangements that will, I hope, make that clearer about the different roles of urgent patient transport and non-urgent patient transport from the ambulance service point of view. But also, I know the community transport, and I've worked with my colleague Gladys Berejiklian, that's an important component as well. I know that I'll also be lobbied by both the Chief Executive and the Chair of the Nepean Blue Mountains Board, but you provide a very, very important service. I'm very happy to take it on board.